Hey everyone, it's Rena Jadif with the Live Longer podcast as well as the Health Bootcamps program. And I'm excited that you are listening in to our book masterclass on Dr. Neal Barnard's program for reversing diabetes, which originally came out in 2007 and is now in a revised edition as of 2018. And of course, it also has a beautiful cookbook as an add-on new book that Dr. Neal Barnard has come out with. Today, on this particular interview, we're going to talk about Chapter 1. Dr. Neal Barnard, welcome.
Thank you. It's great to be with you today.
So let's start with Chapter 1, which is the new basic is the title. Right. How do I know if I have diabetes?
Diabetes is relatively simple to diagnose. With most people, the problem is they never actually went to their doctor to even get the diagnosis. But what your doctor is going to do one of two blood tests. The more old-fashioned one is blood glucose, but more and more are using something called A1C, hemoglobin A1C. And that's a measure of your blood sugar control over the past 3 months or so. More and more people are using that. And here are the numbers. If your A1C is below 5.7, you don't have diabetes, you don't have pre-diabetes, you're fine. If you're at 5.7, your doctor is going to say, uh-oh, you don't have diabetes yet, but that's a sign that your blood sugar is getting too high. And if it's 6.5 or above, that's diabetes. So those are the numbers that you need to know. The good news is that these numbers will change. So while we used to think once you've got diabetes, that's it, we now know that you can change your diet and your lifestyle and you can get those numbers back down. So a person with pre-diabetes can go back to not having it. A person with diabetes can improve too. In some cases, they can get rid of it as well.
So clearly one is testing. What about symptoms? I personally experienced a lot of these interesting symptoms when I was starting to see some insulin imbalances. Dr. Neal, can you share for someone who hasn't gotten tested yet but is thinking, I wonder if I should get tested, what should they be looking out for?
Great. The classic symptoms that we look for are, number one, you're tired. Now, a lot of people are tired. It's so nonspecific. There's a million reasons to be tired. But the reason that people are tired when they got diabetes is that sugar, glucose, powers your muscles. And in diabetes, the sugar isn't getting into the muscles. It's staying out in the blood. And so if your muscles don't have their fuel, you feel tired. Symptom number two, you're in the bathroom a lot. And simply put, you're peeing a lot. What's that about? If you have too much sugar in your blood, sooner or later that sugar goes through the kidneys and it carries a lot of water along with it. And so you're urinating a whole lot. Symptom number three, you're thirsty, and that's simply because you're losing all that water. So you go to the doctor and you say, I'm tired all the time. I'm in the bathroom so much, and I'm really thirsty. And the doctor says, they told me about this in medical school. Let's do a blood test. And the doctor looks at the numbers and says, you got diabetes, or you got pre-diabetes, or you don't. But those are the classics. Now, big caution. A lot of people have diabetes without any symptoms at all. Oh. And their first symptom is a blood test that said you've got diabetes. It's very, very common now, becoming more common all the time. But many people do have those symptoms. There can be late symptoms too, where you had a wound that didn't heal very well, things like that. But that's really pretty much it.
You mentioned something very interesting, which is people might not have symptoms at all. So at what age do you recommend people just go get tested in case they're curious about whether they're starting to see some imbalances?
Yeah. Well, first of all, anybody who doesn't feel well really should get tested because getting a blood sugar test is so easy, so cheap, and you might be getting a cholesterol test or something else anyway. It's the easiest thing in the world for them to also check how your blood sugar control is doing. If you're overweight, for just about anybody, we used to always say kind of anybody over 40, you want to have a higher index of suspicion. Okay. We're changing that now because we're starting to see type 2 diabetes in kids.
Oh, no.
Never used to see it. Now we do. Kids 16, 15, 14 years of age are starting to get it. It's not because their genes are changing. It's all because of food. Nonetheless, despite how troubling it can be to know that kids are at risk for things like diabetes, that's the time when it's easiest to intervene.
Oh,
As long as the kids and their parents are willing to think this through.
okay.
Imagine if you have a child, let's say kids pick up cigarettes. They're 16 years old, and they're walking home from school, and they're smoking cigarettes. You think, oh, that kid's at risk for lung cancer. Yeah, sure, true. But if that kid stops smoking and stays cigarette-free, do you think they're going to get lung cancer? Very likely not. So when you had a shot across your bow, which is you got a high blood sugar when you're 16 years old, and if the whole family together says, wait a minute, we don't eat very well.
Right.
Come on, team, let's ramp it up. All of that can change, and it can change very well, and not just for the kid. It can change for the brothers, the sisters, the parents, the aunts, the whole family culture will change.
I love that. I love that. All right. Well, on the next video for this book masterclass, we are going to talk about reversing type 2 diabetes.